We're just getting started, aren't we?
We are.
Oh my goodness.
We have a lot coming up on this show. So coming up next, she's one of the best in the business. Dr. Jennifer Walden is here to show us how technology is changing the face of cosmetic surgery and how patients can benefit.
Hopefully she'll get you to take that off.
Well, when it comes to plastic surgery, she's known as one of the best in the business. I'm here with Dr. Jennifer Walden. You're a plastic surgeon with Westlake Medical Center. Thank you so much for joining us.
Thank you, Allison.
We just coordinate so well today for USA.
Red, white, and blue.
Awesome. So we have a lot of fun tools that you're going to be talking to us about. And plastic surgery, I mean, it's been around forever, but technology has really changed it lately.
Right. There are a lot of advancements in plastic surgery, especially cosmetic plastic surgery. One is the PEAK Plasmablade by Medtronics. It's an alternative to a Bard Parker, the stainless steel scalpel, which was invented in 1915. But basically, this takes the place of a scalpel, and we can actually cut and coagulate tissue with this to cut an incision and then to actually stop bleeding. So we can do a whole operation relatively skin to skin, and it helps with cut down bleeding, cut down on drainage. In breast surgery, it helps clear surgical margins for a pathologist to see a tissue specimen, and it helps the procedure go faster, so it can be cheaper for the patient and the plastic surgeon who's running their operating room.
Wow. I mean, and so this is for, I mean, tummy tucks, breast augmentation, facelifts, everything like that?
Absolutely. It can be used in the field of plastic surgery, and it's also used in orthopedic surgery, spine surgery, general surgery for mastectomy and that sort of thing.
Wow. How long has this been around? I mean, when did we kind of make the switch?
Well, electrosurgery or Bovie electrocautery has been around since the early 1900s, but actually this technology since the early 2000s, but it's really in the last few years that it's been in circulation, FDA cleared, and that we're able to use it. Surgeons can use it in the United States. So very exciting new technology.
Yeah.
Really.
That is really cool. And you have another tool over here. It's called the Zipline.
Right.
That makes it sound fun.
The Zipline is basically a little closure device, and it takes the place of staples or sutures. Now, we don't use this on every case, but certainly on a long incision like a tummy tuck, breast reduction, orthopedic surgeons over a joint surface like arthroscopy, shoulder surgery, the knee. Basically, it's adjustable. We stick it on the patient, and then we can close the device like this, and we can have an adjustable amount of tension over a joint surface or a very long closure, and so it makes things go fast.
That's incredible.
Also, for people that they don't sew a lot, they don't suture a lot, a person who is in the emergency room closing some type of a clean laceration, it can be used. It can also be used in the cath lab over pacemakers and that sort of thing for technicians.
And is the healing faster as well with something like this?
Healing has to do with a lot of factors, and mainly it can do with the method of the underlying closure and the patient's comorbidities like diabetes and that sort of thing, but it actually can help with wound healing, and it produces really nice incisional scars.
Wow. This makes me feel better about maybe down the road. If I need some, I might need it now, who knows. But I want to talk about you because people may actually recognize you. You were on 90210.
Sure, I was on Dr. 90210. I practiced in New York City for 8 years, and now I practice back here in Austin for the past several years. And I'm at Westlake Medical Center, 100% cosmetic surgery. And I wanted to say the most important thing is not the new technology or the actual blade, but it's the person behind the blade that's actually utilizing that. So go to a board-certified plastic surgeon, preferably one that's a member of a foremost organization like the American Society for Aesthetic Plastic Surgery. Pick your surgeon right, because it's not the scalpel or the device, it's actually the surgeon.
Yeah, because it can be a little tricky and a little daunting when, you know, you come to this realization, okay, I want to get some work done. You maybe do some Googling on the internet, and who knows what you're going to find.
Right, right. And there's a lot of misinformation out there. Checking credentials online, you know, with the state medical board, your surgeon's website. Mine is drjenniferwalden.com. Smartbeautyguide.com is by our professional organization, and it gives true factual information on how to find the right surgeon and real information on these procedures, the downtime, the recovery, expense associated with them, because they are real major invasive surgical procedures, and so you want to go to the right person for them.
Yeah, I mean, you want somebody that has the new technology but knows very well how to use it. So did you have to go into, you know, a lot was there a lot of training behind a lot of these new tools?
Well, once you know how to use your hands and you know how to use a scalpel blade, a lot of these tools come very naturally to a surgeon who's good with their hands.
Right.
Obviously, the companies and the representatives help with that and facilitate that in your office or in the hospital. But once again, it's the person behind the knife that's important. You know, we can either work wonders, or if they're not properly trained, they can create a disaster, a real mischief.
Right. And I can't believe, I mean, you seem so young, and I don't know how you made Harper Bazaar's magazine hottest surgeons on the cutting edge.
Well,
I mean,
that was very flattering.
Right.
And, you know, I don't even know the beauty editor, but actually, you know, I was listed as that, and so that's very flattering. As far as young, I'm not that young. I have twin 3.5-year-olds, and I actually do a little Botox myself and a little bit of laser, and that can help me stay
young forever.
Absolutely.
That's awesome. Well, we have some information. Is the website probably the best place to go to?
Absolutely. That'd be great.
Yeah, drjenniferwalden.com, and that's where you can find out more information from Jennifer. Also, Facebook. You're on Twitter as well, so you're keeping kind of up to date in social media. People can reach out that way.
Sure, absolutely. Check me out, interact with me, and join me on Facebook or Twitter.
Awesome. Is there anything else we want to let our viewers know before we go to break?
No, I just appreciate you for having me, and have a happy 4th of July.
Yeah, you too. We appreciate you coming in, so maybe we should slice these up and put them on the grill.
Yeah, definitely. Let's do it.
How does that sound, Chris?
It sounds tempting. It does sound tempting.